Hello, my name is EshikaParuchuri, and I'm studying 11th grade at the Woodbridge Academy Magnet School in New Jersey. I would like to begin by thanking you for joining me in this initiative. The main objective is to educate and empower adolescents around the world to help them construct a healthier lifestyle by working with experienced doctors across different specializations around the world. In addition to promoting health education, I hope to inspire many interested teens to pursue careers in healthcare, not just as future leaders, but as individuals prepared to respond to urgent public health challenges, from everyday medical needs to global crises like the COVID-19 pandemic. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Pranith who specializes in nephrology. He has extensive experience in this field, working as a consultant nephrologist and renal transplant physician at the Yashoda hospitals in Secunderabad, India. And for this episode, we'll be focusing on general nephrology, public health issues that concern teens, as well as steps that can be taken to have a healthy lifestyle. And now, Dr. Ram, can you give us a little background regarding your experience in this field?
Yeah, first of all, I would like to thank Eshika. I would like to appreciate your efforts, for your thoughts, for having the will to educate the teens to have a healthy lifestyle. And thank you for having me. I'm Dr. Pranith. I work as a transplant physician at Yashoda Hospital, Secunderabad. I graduated from Usmani Medical College in 2001 batch, and after that I did my MD and DM from All India Institute of Medical Sciences, Delhi. My areas of interest are doing transplants and doing interventions related to nephrology. I finished in 2017. And after that, I started my career in the private setup, and I've been in the field for almost eight plus years. So this is in short about me. Yeah. Let me know how I can help you in this.
Of course. So now let's dive right into our questions. First, we'll begin by discussing nephrology and how the kidneys work. So, what exactly is nephrology, and what do the kidneys do in our body?
Yeah, basically, nephrology is a subject related to medicine. Okay, it's a field related to the kidney health and kidney diseases. So primarily, we deal with the problems related to kidney, right from the filtration problems, urinary tract problems, obstruction, and urinary tract infections. It starts from the kidney and ends with the urinary tract. Bladder. Yeah. So basically, the function of kidneys is to excrete the waste material in simple terms. So what it does is it filters all the waste materials and concentrates in the urine and excretes out from our body. So its primary function is to keep the waste material out of our body. Apart from this, it plays a major role in keeping our body system in balance. It keeps the fluid balance. It plays a vital role in electrolyte balance. And also, it has important hormonal functions like production of erythropoietin, which is a hormone which keeps the blood cells in a healthy state. It keeps the hemoglobin in the normal state. Apart from this, it also has a key role in maintaining the muscle health and also bone health. So briefly, we can say that it has a role in excreting the waste material, keeping the body electrolytes in balance, and has key role in the endocrine function. So yeah, this is in short about the kidneys.
Oh, so our kidneys do a lot. And what would happen if our kidneys stopped working properly?
So if they won't work, okay, obviously all these functions won't occur in our body. Like our body will be full of waste material, so we'll have symptoms related to the accumulation of the waste material, and also the problems we notice because of the fluid imbalance and also the electrolyte imbalance. Obviously, because the hormones are not produced, the body hemoglobin will be low. So, and also the bones are prone to fracture and will be very weak. So, all those symptoms will actually occur in the late phases. These problems will not be identified in the early phases. So it's like that. Only when the kidney function is lost by nearly 60 to 80%, then only we'll actually identify all these symptoms. In the early phases, it's difficult to pick. Yes.
And what's the difference between acute kidney injury and chronic kidney injury?
Yeah, these are actually terms related to the kidney disease. Acute means the problem which is not there and it has happened very recently. Means it has happened over the days to weeks. Majorly, these problems are related to immune system, or these problems are due to the some infection or the reaction to the drugs. And often, if we identify the problem and treat, these group of diseases are reversible. So acute disease are recent onset and reversible. If we treat them appropriately, it is reversible. Whereas chronic is total reverse. Chronic disease often they are irreversible, and not only that, they are progressive in nature. So the two important characteristics of chronic disease is they are irreversible and progressive in nature.
Mhm. And how early can kidney disease start, and can it be prevented?
Uh, a kidney disease can occur at any age, right from the birth. It can occur, and it can happen in the late stages also, late stages of life. Often, people die because of renal failure. Okay, and it's saying that almost for everyone, the kidney function will be gone at the time of death. So, majorly the problems are classified or divided as per the age groups. We often see the genetic diseases and problems related to the immune system in the early phases of life. Whereas in the middle and late phase of life, we see the diseases related to the comorbid conditions like diabetes and hypertension, and also immune problems are also common in the middle age group. So, whereas in the late groups, we see the diseases related to the comorbid conditions. So, it is divided like that. The spectrum of diseases varies as per the age.
Mhm. And I've heard that it's possible to live perfectly fine with only one kidney. So how does that work? And does it affect the overall health?
Yeah, yeah. People can live with one kidney. So because one kidney will take up the burden of the whole body, and it can take the burden, and it can easily function as efficiently as before. But in some scenarios, living with one kidney is dangerous, or it will lead to the progression of the kidney disease. Often the renal donors live with one kidney. So donors and healthy subjects, they can live with one kidney, whereas the people who are having the chronic conditions like the diabetes, hypertension, and those who have family related kidney diseases, they actually progress their kidney disease over the period of time. So, to be succinct, like one can live efficiently and healthily even with one kidney also. But we should make sure that we should not stress out that single kidney, because if we stress out with the single kidney needs, and it will overwork, and naturally it will tired and get its functions deteriorated over the period of time.
Mhm. Okay, so now we will transition into talking about common conditions and treatments.
Okay.
What are some common kidney problems that you have observed in teenagers or young adults?
Yeah, as I said, the problems particular to the age group, that teenage group, are different to the elderly age group. In the teenagers, the problems are more because of the immune system, because of the genetic problems, because of the urinary tract infections, because of the drugs, like taking the over-the-counter drugs like painkillers, all those things. So these group of diseases are more common in the teenagers. Uh, and whereas in the elderly group, the problems are more because of the comorbid conditions. So one should be aware of the kidney disease to identify themselves in the early phases.
Mhm. And can kidney problems be reversed if they are detected early?
Yes, as we discussed early, like acute diseases are often reversible.
Yeah.
The point is, we need to identify the problem. We need to treat them appropriately. Many a times, acute diseases are reversible, but some diseases are very severe, and it's difficult to reverse them. And identifying the problem is also difficult in the kidney disease, because often they are silent, and they won't express any symptoms in the early phases. So it is a catch actually. Like identifying the disease is not that easier in the early phases, and only if we identify them in the early phases, we can reverse. Yeah.
How does kidney dialysis work?
Uh, Kidney dialysis works. Basically, dialysis is a filtering mechanism similar to the kidney. Okay, the apparatus of the dialysis is also similar to the kidney. It basically flushes out the waste material along with the excess fluid. So it basically functions do functions similar to the kidney, especially the excreting waste material. But if you look at closely, it won't perform other functions like endocrine functions and controlling the blood pressure. All those things won't be done by the dialysis. So it is actually a partial renal replacement therapy. It's not a true renal replacement therapy.
Mm. And how long can someone live on dialysis?
Uh, yeah, see, it actually it's the survival on dialysis is very poor. The data suggests that nearly 50% of patients die by the end of 2 years. Suppose if we initiate dialysis for 100 patients at this moment, and that number will become 50 after 2 years. So it has very high mortality. The mortality is more common in the patients who are elderly, those who doesn't have any access. Access means we place a catheter, or we'll create a fistula to take out the blood. Those who doesn't have proper access, those who are having cardiovascular disease, this group of patients are at high risk of mortality. So data says that 50% mortality at the end of 2 years. Yes.
And in more about talking about your practice, what kind of patients do you usually come across?
Yeah, we see wide spectrum of patients, right from simple urinary tract infections to transplant. Often we see a lot of load regarding the patients who are having chronic kidney disease, acute kidney disease. This group of patients actually are more commonly seen in the daily clinical practice. Um, and Yeah. So basically, we treat almost all spectrum of kidney disease in the day-to-day practice.
Mhm. How does a high blood pressure or diabetes affect kidney function?
Uh, See, basically, these are chronic conditions. Chronic conditions, they not only damage the kidneys, they actually have impact on all organ systems. Like they will have impact on the cardiovascular system and also the brain. They are multi-systemic diseases basically. So the way it affects the heart, it also affects the kidney. So, diabetes and hypertension actually, if you split the causes of the chronic kidney disease, they occupy more than 50% of the chronic kidney disease. So, they are an important cause for the chronic kidney disease, and those who are having these comorbid conditions, they are actually, in fact, more prone for acute disease also. So they are more prone for urinary tract infections. They can't take the extra burden because of the infection happening in the body. So they are at risk of acute kidney disease also. So it is important to manage these comorbid conditions, especially when they are identified early in the phase of life. So one should actually control the blood pressure and also control the diabetes once it is identified in the early phases of life, so that we can actually reduce the burden on the other organ systems.
And with that, we'll transition into talking about signs and risks and prevention. How can you tell if someone's kidneys aren't working properly?
Uh, See, it's difficult to tell. According like it's difficult to identify the kidney problems in the early phases because the symptoms are not seen in the early phases. So these group of diseases are called silent diseases. They are actually called silent killers. The huge chunk of patients will actually develop symptoms when majority of the kidney function is lost, like nearly 60 to 80% of kidney function is lost. Then only we will identify the symptoms. The usual symptoms are, and if you look at the symptoms, they are also very vague. Okay, some patients will have vomitings, nausea, okay, weakness. Some patients won't pass the urine properly, like decrease in the urine output and swelling of the limbs. And some patients just will have hypertension, nothing more than that. So it is very important for a physician also, for a physician who is not practicing the nephrology, who doesn't know, practice nephrology, to identify these subtle cues and look at the kidney problems in the initial phase itself, so that they can refer to the nephrologist in the appropriate time. So the these are called silent killers. This is my one word answer to this question.
And usually, when you do determine that kidneys aren't functioning properly, what are some of your first telltale signs?
First telltale signs, it's as I said, it's difficult to pick. If we identify those symptoms, then we are actually really fortunate, so that we can identify the problem. The usual symptoms are the specific symptoms are like swelling of the limbs, early morning facial puffiness. Like if the patient wakes up, they see their eyes puffed up. Okay, this happens because of the proteinuria. Okay, and not having proper urine, like they are unable to excrete the urine properly. So these are the specific symptoms related to the kidney, and um, uh, the symptoms which are commonly seen in advanced renal failure are nausea, decrease in appetite, and excessive weakness. And they vomit whatever they eat. All those things are commonly seen in the advanced renal failure. And some patients will have skin rash, especially the patients who are having immune-related problems like lupus and all. They will have a skin rash. Sometimes IgA, the vasculitis, also will present as a simple skin rash. So it is also important for the other department doctors like dermatologists to have that kidney disease in their mind and refer to the nephrologist appropriately, so we can treat them in the right time.
Can things like stress or lack of sleep also affect kidney function?
Not directly. Like they actually affect the kidney function in an indirect manner. They cause the chronic conditions like diabetes and hypertension. Indirectly, they can affect the kidney function, not in a direct manner. So obviously, stress and decreased sleep also will affect the kidneys.
Mm. Can dehydration or maybe overexertion from sports impact kidneys?
Yeah, yes, naturally. Actually, dehydration is very important thing to address, especially for the teens. It happens because if you won't hydrate yourself in an appropriate manner, so it is like that. Like if you are asked to live with little money, like little amount of money, means naturally you won't be spending that much. Okay, it will be you will try to conserve. So our body also will try to behave in that similar manner. If we are not hydrating, means there is not enough blood pressure. There is not enough blood in the circulatory system to go to the kidneys. So kidneys will naturally underperform. So. So they are at risk of developing kidney injury if we won't hydrate them well. Coming to the other part, like if we over hydrate or if we over exert, over exertion means like what will happen means like if we do over exert the muscle is prone to injure. Okay, so naturally, if the muscle gets injured, then the proteins from the muscle will be released, and they will block the kidneys. So in the kidneys, basically, we'll have functional units like nephrons. Nephron is like a complex structure. It's like a stethoscope. It has a filter in the head part, and rest of the part is like tubules. So the filter is meant to conserve the things which is important to the body. And the tubules will, after the filtration happens, the tubules will reabsorb whatever the things which is necessary to the body, it will reabsorb. Okay, the main function of the filter is to conserve the material which is important to the body, and the important function of the tubules is to conserve the electrolytes and the fluids which is important to the body. So it is a very complex structure. So what happens in the muscle injury is like these proteins, the myoglobin, which is a protein specifically released from the injured muscle, it will come and block the tubules. So ultimately it gets blocked, it gets clogged. So kidney function will be acutely impaired. So they are also important group of diseases actually.
And how does diet, like eating too much salt or sugar, affect kidney health?
Uh, Too much, yeah. Salt is actually important for our body. It is an important component of our vascular system. Okay, if we eat more, means if we eat salt, means like it will actually result in hypertension. So hypertension will lead to kidney damage. If someone eats excessive salt, means it is like making the kidneys to work more. So the kidneys will work more to excrete that salt. So in that manner, it actually increases the workload of the kidney. So similarly, sugar also will make the kidneys to work more, and not only that, the sugar eating direct sugar will actually cause diabetes, comorbid conditions, which again impair the kidney function. So the diet which is rich in salt is not good for the patients who are having kidney disease, especially chronic kidney disease. It is not good for them.
Okay. Now we'll be switching topics and discussing about lifestyle and kidney health. So, what are some everyday things that teens and young adults can do to keep their kidneys in good function?
Um, See, one should be aware that kidney problems happen to all. Like one thing which is important is to become aware of the kidney disease. That is more important. And apart from that, practicing the healthy lifestyle, like eating healthy, taking adequate amount of protein, and hydrating themselves. These are the simple tips which will actually help not only teens, everyone to keep themselves healthy. So, if someone has any kidney disease in their family, it is also important for them to go and consult a doctor and get their kidneys checked, so that we will identify the problems early in that scenario. Once we identify the problems, means then we can actually try to cure them, or if it is a chronic disease, we will try to reduce the progression so that the longevity of the kidney is increased.
Mhm. How much water should a teenager be expected to drink to have good kidney health?
See, now this question is not related to teens. For everyone, it's important. See, if the water intake, it actually should balance the output from the body. Like it should actually match the output. Okay, the intake should match the output. So the output means the water output from the body is divided into two components, like sensible losses, means the losses which we can perceive, like the loss of water in the urine. Okay, that we can actually calculate, and and other component is insensible losses, means the loss which happens in the breath. We will actually take that every minute, right? So in that air also there will be water. The humidification happens so that water is lost. So the water that is lost in the breath and also from the skin, those are called insensible losses. So the insensible losses for a any person is estimated to be around 10 to 12 ml per kg per day. So roughly for about for 70 kg adult, so this loss will be about 700 to 800 ml. So this should add to the urine output. So if someone is passing around 2 liters, means 2 liters of urine, means then we should add these insensible losses to them and ask them to drink. Again, here the catch is like we will for a patient, if a patient comes and asks how much fluid I should take, means if they are having a kidney problem, means we'll actually ask them to reduce the water intake. This is what I told previously was for a healthy person. For a diseased person, we will actually ask them to drink less water. So again, that amount is calculated as per the patient's output, and also as per their other comorbid conditions, like if they are having heart disease, if they're having liver disease, again that water intake will be curtailed. So that is estimated as per the patient. For a healthy patient, it is different. For a patient who are having disease, it's different. So roughly, it should match the intake of water should match the output in the body. Again, output is of two components, that is sensible losses and insensible losses. As per this, we need to advise. Uh,
Now we'll transition more into talking about professional insights and what a career is like in nephrology. So, what inspired you to become a nephrologist?
Yeah, basically, I like medicine. Okay, I my mind is inquisitive. I like medicine. I try to find answers by myself. So and nephrology is equal almost. It has it overlaps medicine a lot as compared to other super specialties like cardiology and gastroenterology. They also have some overlap in the medicine part, but nephrology is almost similar to the medicine. So that made me to choose the nephrology. So I enjoy trying to find diagnosis for a patient. Uh,
And what do you enjoy most about your work?
uh, no, see, Um, I like doing transplants. I love that because in in day to day life in a nephrology career per se, we treat patients in a varied spectrum of patients, but transplant is one thing which will actually give more satisfaction to a nephrologist. Okay, it's like offering the complete cure to the disease. Okay, although it is a very complex and stressful thing, I like doing that. Transplant is like giving rebirth to a patient. It's like giving a second life to the patient. So I enjoy doing transplant.
Very nice. And is there a word of advice that you would like to give to a teen who is interested in medicine or nephrology?
See, see if only what I offer, what I can offer to a teenager is actually it depends from person to person. My advice is to develop an inquisitive mind, like try to find why and answer yourself, and also uh, uh, try to get answers by asking questions, by asking yourself why and how, and try to find answers. So if you have that inquisitiveness means, then naturally you will be more passionate to your career. So that's a basic one sentence answer to your question. Yeah.
Mhm. And now we'll be discussing some common myths related to kidney health. First
Okay.
myth: over the counter pain medicines are totally safe for your kidneys.
Um, no. Actually, it's not it's not true. Over-the-counter medicines are not at all safe to the kidneys. Okay, it has like we need to see the components. Components are the drugs which you are taking. Some drugs like NSAIDs, they give instant relief to your pain, but at the same time they damage your kidneys. Especially if you're taking those drugs, means then they damage your kidneys and they cause irreversible damage. Often, I see in the clinical practice, especially in India, the people who come from the rural India, they work in the fields and they get pain. So and they take painkillers by themselves or by local practitioner prescribes them. They take them and they come to me with rising creatinine. Some people will straight away come with advanced renal failure, and we have to initiate dialysis. So it is such a hazardous thing. So one should not take the medicines on their own, and you have to see the components of the medicine and then take. And if you're taking the painkiller, means you should not take it for a longer period, only for the brief period for the relief of pain. But too, if someone advises, then it is advisable. taking the drugs for a longer period is not safe.
Mm. Salt only affects your heart, not your kidneys.
No. Salt is an important component. Okay, it's a saying that we are all the human form or the life has taken birth from the salt. Okay, the salt broth. Okay, so if you look at the cell component of cell and electrolytes, it is made of salt. Okay, so it is such an important molecule and component in our body fluid, uh, and it is obviously important for the circulation system to go through. So, but if we take excessive salt, means it actually harms not only one organ, it affects almost every organ. It affects the brain, it affects the heart, it affects the kidneys. The what way it affects the kidneys means like it increases the hypertension. Excessive salt intake will increase the hypertension and also will cause the kidneys to work more. So it increases the workload of the kidneys. So it harms in that way.
Mm. So it's very involved with the kidney system. Next, dialysis is a cure for kidney disease.
No, dialysis. Dialysis it's actually comes under the category of renal replacement therapy. If you ask me, it is actually a partial replacement therapy. In the early part of conversation, I told that it only performs only one part of the kidneys, that is excreting the waste material and also the flushes out the excessive fluid. So it only performs the partial part of the renal replacement, partial part of the kidney functions. The actual treatment, or the complete replacement will happen only with the if we replace with the other organ. Again, these two modalities, that is dialysis and transplant, is offered to a patient who are having irreversible kidney damage, irreversible form of kidney damage with advanced symptoms. Means the patients who are having advanced azotemia, and then only we'll offer this form of treatment. If you compare dialysis and transplant, there is a lot of difference. As I said, the transplant will do all the functions, will do all the transplant organ will do all the functions of the normal kidney. So in that manner, it actually improves the quality of life to the patient and also increases the lifespan of the patient. In dialysis, we won't see that much survival, and dialysis is it's like the patient will feel better in the initial phases, but as the time passes on, the quality of life is very poor. That patients often die on dialysis. So if there is any chance for a patient to undergo transplant, they should actually undergo transplant as early as possible.
Okay. And for our last myth, if kidney disease runs in your family, there's nothing you can do.
No, nothing. It's not like that. Actually, we have to be. We should think in other way around. Actually, if a disease is there in the family, means we are fortunate that we have identified the disease in the early manner. So it increases our awareness. So one should consult the doctor in the early part and get themselves tested. If the disease is identified, there are a lot many medicines to offer to increase to decrease the progression and also increase the longevity of the kidney. So we should think other way around rather than getting depressed because the disease in their family. See, everyone will have problems. Everyone will die some or other day. So it is no one will live on earth for 100 full years. The point which is important is we should live our life happily. So if someone has a disease in their family, means we should also go and test it in a positive manner. We have to take it in a positive thing, okay, and get themselves tested for that.
Very nice way of putting that. Now we will move on to our final two questions. First, what do you believe has changed most from when you first started working in this field to now?
See, I I have I belong to newer generation of nephrologists. I have not seen much change, but I have seen change in myself. Okay, in myself, in approaching a patient. Okay, I have seen myself evolving in counseling, in identifying the problems, in conveying the patients in their own understandable language. I see a change in myself, not much in the field of nephrology. Yeah, in the recent past, in the recent times, we are seeing the role of AI, artificial intelligence in yeah, maybe we will pursue the benefits of the artificial intelligence in more in the coming times. I'm hopeful for that. Yeah.
And lastly, could you tell us about one of your most interesting or challenging patient cases?
Uh, yeah, one thing I would like to share is my experience. Like, um, I have transplanted a child who is 8 year old. Father was a donor. He is an international patient. I found it very challenging. Very challenging means because I was of opinion that because the father is donating the his child, okay, not much complications to happen or more. I was very confident that everything will be smooth. Okay, that child has rejected on day 7 or day 8, and it was a nightmare in my life. Okay, and ultimately the patient we have to the rejection was also so severe that we had to remove the graft. It was a tough time at that point to counsel the family, and I didn't sleep for many days in that phase. Sometimes surprises happen. Okay, we need to um, keep ourselves prepared for the adversaries. Okay, so nothing is taken for granted. That I had learned. Okay, and we have to be prepared for all the surprises. It's not a everything won't go by our predictions.
Mm-hmm.
Yeah.
Very nice. And with that, I'd like to conclude our podcast. I'd like to thank you once again for your time, input, and contribution. I think this podcast went pretty well, very educational. And yeah, for our listeners, we have a slogan from our doctor.
Yeah. Nourish your habits to flourish your lifestyle.
Thank you.